Hey guys, welcome to CHIRO Coffee Chat. I'm Dr. Pete.
I'm Dr. Carla.
Today we're going to be talking about virtual consults. So it's been this is April of 2021. The last year, as our viewers know, has been interesting.
Yep, to say the least.
Yes. And so many of you have been staying home to be safe. Perhaps you might even be immunocompromised, or you have kids at home, so they're doing homeschool, so you have to stay home. But if you're having a health problem and you're needing help or you're needing an opinion, if you are staying home, how are you going to get that?
Virtual consultations. That's what we're shifting to. It's what everyone's shifting to.
Yeah. Not exclusively, but as an option for our patients.
Yep.
And so virtual consults are really cool because they let us, have a talk, basically do like the components of our exam. So a health history, we let the patient would be able to ask questions, tell their story about what's going on with them. We can then in turn ask questions to get some more clarity. And then, so that part is kind of similar to in office.
Yeah, of course.
But the tricky part comes when we're going to do some type of physical exam testing.
Right. So walking them through the physical examination is the tricky part with the virtual consult.
It's tricky. I'm going to say it's doable to a pretty accurate extent, not exactly the same as we could do with an in-office hands-on consult, right? But one thing that we might be able to do with a virtual consult is identify if we can handle or come up with a diagnosis and handle some type of treatment through that consult, or whether we would advise that person to actually come in for a more detailed exam, or perhaps, depending on what's going on, even see another healthcare provider if they had some issue that might require some different type of care. So we're going to just walk you through what a virtual consult could look like. So let's head over to the tables for that. Okay, so we're going to demo a virtual consult. It's not actually virtual because we're in the same room, but we're going to pretend I'm in my office. Dr. Carla is at her home, and so I'm going to be talking to her and talking her through this. So we came up with, this is a patient who has, what's your problem?
My neck is just killing me ever since starting to work at home with the new home office setup. So
very common problem. So I'm going to ask some questions. Do you feel it more on your left side or your right side?
On my right side.
Okay. Are you getting any pain or sensations going down your arm or into your fingers or hands?
Occasionally I'll get numbness, tingling into my right hand. Down my arm into my right hand.
Okay. So those are important things. I would ask, of course, how long has this been going on?
I'd say probably last 6 months.
6 months. And that's what we've been hearing. You're probably hearing that with patients too.
Yeah, for sure.
So I would ask more questions, get more background with this patient. But now to examine them, we would start with some of the tests that we would do in the office. So one of the first tests we would do is range of motion. So I would ask my patient to put their hair up. That'd be number one. So we can see their neck and their base of their skull. And so I can verbally tell the patient what to do, or I can do it and have them mirror me. So I will say, Dr. Carla, you're at home. Can you, so you're going to look straight ahead to start. You're not having any extra pain in this position? Nope. Okay, so look up to the ceiling. And I'm going to watch how far she goes. Yep, and back down. Any pain with that?
No.
Nope. Okay, you're going to look down to the floor. Okay, and straight. How about with that?
Definitely like a pulling tight sensation.
Okay, so that's information for us. Turn your head all the way to the left. So I can see she has good range of motion that way. Back over to the right. Okay, and same questions for her. Any discomfort with that? Any worsening of symptoms?
It's pretty tight along the right side.
When you turn to the right?
Yeah.
Okay, so that's telling us probably that the joints in the right side of her neck, her spine, are irritated, because when we turn that way, it compresses them a bit. So that's giving us more information. Next test would be side bending. So you would put your left ear to your left shoulder. Okay, and right ear to right shoulder. And anything with that?
Pain on the right side as I bend to the right.
So more confirmation. So now when we see those things going on, a lot of the times the next thing we would do would be some orthopedic tests of the cervical spine to look for nerve root irritation. So I would have to instruct her in those. So I would ask Dr. Carla, could you, if you turn your head to the right and then tilt your head back, so you're compressing sort of through your right side of your neck. Can you try doing that?
Right.
And then drop your ear down. Does that cause anything going into your arm or hand? Numbness, tingling, pain, or pain in the neck?
It's definitely painful along the right side, and then I know if I leave it here, I'll start getting some tingling into the hand.
Okay, so that's kind of, we're doing an orthopedic test to get more information. That's great. So that's a kind of like some basic tests that, again, we would do in the office that we can instruct our patient to do virtually and get more information about their problem. The challenge here is that I wouldn't be able to, this is a lot of times in an exam where you'd actually put your hands on the person.
Right.
You would do, one of the tests we would do is called cervical doorbell test, where we're pressing in through the lower cervical spine and seeing if that aggravates the pain or numbness and tingling into the extremities. Can't really do that one. We could be palpating muscles and joint play. We can't really do that right here, but that gives us some information. This might be a patient with those type of symptoms where we would say, you might be beyond just doing exercises at home for something like this. We might want to bring them in the office and do some imaging if they've had those symptoms into the arm for 6 months, a longer period, so we can get a better handle on what kind of care would be needed to get them out of the situation. If it was a lot more minor, so if she went through the tests, if she didn't have anything into the hand, if it was just some neck tension in certain areas, we might be able to just give some exercises that the person could do at home, which might take care of the issue.
Stretch out the tight muscles, stretch
exactly.
the weak ones.
Yeah,
from there.
Absolutely. So just a little example of what we might be able to accomplish. But here's a thought too. If you're sitting at home, you don't know anything about spine or orthopedics or how your body works, you could be, it happens. People get symptoms into their arm. They wonder if they're having a heart attack or something.
Of course.
Right? So a lot of times those people, they might go to the doctor or the hospital, get that checked out. Okay, heart's normal, now what? And they're not really sure what to do. So we can do a consult like this virtually and let them know, like, these symptoms are probably coming from musculoskeletal tissues, nerves, joints, muscles, and that can sort of put them at ease and, again, can guide our decision making for how we might be able to help someone get out of that situation, whether it be from home or whether they want to come in the office, and we can help them that way. So
formulating like a plan of action is kind of the best tool with the virtual consults.
Absolutely. And to do that, we first need a good idea of the diagnosis. In other words, what is actually going on with this person, what tissues are involved. If we did some tests and had, for instance, if you were an older person and you said, yeah, my left arm is tingling and I'm having chest pain, we might say, let's stop the virtual consult. We want you to call 911 and get to a hospital. So again, that may be, it's a more extreme example, but there's quite a bit of information we can get through something like a Zoom call that can help you and perhaps allow you to, again, stay safe in your home and get this information. So
give you some peace of mind too. It's always stressful when you feel like you're stuck at home and feel like you're, in your own little cage in there and you don't have any other resources. It's just a great thing to add on so that you can get peace of mind that, this is something that the chiropractor can deal with. So
absolutely. And I think, as far as conditions, last thing I'll say, as far as different conditions we could assess in this manner. So anything with the spine, headaches, migraines, things like carpal tunnel, sciatica, possibly hip issues, shoulder issues, really any joint muscle system we could have a conversation about. We could do some basic tests and have a bit of an idea of what's going on, and then direct from there. Where do we go from there? So hope that helps you guys get a better understanding of how virtual consults can work and how they might help you. Thank you so much for watching Chiro Coffee Chat.
Have a good one.
See you on the next one.